A great question from Jen, who says, what are alternatives to dexamethasone for patients who develop steroid side effects like psychosis? Well, we use dexamethasone in multiple myeloma for lots of reasons. It actually has a direct anti-myeloma effect. When I started in myeloma over 20 years ago, dexamethasone alone was often given as treatment for myeloma. But we know it can also reduce side effects from drugs, particularly the infusional reactions where people can have a reaction to a drug. It can also reduce pain, and it can also reduce nausea. So dexamethasone is a really important tool in the toolbox of multiple myeloma. But that being said, as you noted, Jen, people can have lots of different side effects and sometimes as extreme as psychosis. So we can use alternatives, other kinds of steroids, things like prednisone and others that aren't quite as dramatic. Furthermore, we know that we can also use less dexamethasone than we used to use. Now that we have so many other options to attack myeloma, the role that dexamethasone plays is diminished. And so I would encourage you to talk to your provider about using lower doses of dexamethasone as you're being treated. The IMF has a whole host of educational offerings throughout the whole year, and you can learn about these virtual and in-person webinars and seminars at events.myeloma.org.